so now that we've assessed the patient's upper body, we can now move on to the lower extremities and the abdomen. But before I move on, I forgot to assess my patient's nares, so we can go ahead and do that now. Which is the good thing about assessments, you know, if you forget something, you can always go back to it, and then eventually you kind of get your own rhythm down and do your own assessments in your own way. But for now, we'll just go ahead and go back to assessing the nares. So, like always, we start with inspection, just looking for symmetry. There's no lesions. I don't know any drainage coming out of the nostrils. And then you'd want to assess patency of the nares. So you would want to occlude one and have her take a deep breath in through the nose. And test the other side.
I can't breathe out that side.
So she's a little occluded on her right side. So you'd want to take note of that if they had an occlusion, and then you could inspect the inner part of the nose. So just looking up inside the nose, you want to assess for any drainage. The mucosa should be nice and pink. Then you'd also want to look for any septal deviation in the nostril, which she had none. So now we can move on to the rest of the body. So first I'm going to assess her upper extremities. So I'm going to check her radial pulses. Go ahead. And here you're just looking for strong, equal pulses, which she has them. And then you would go ahead and test range of motion. So, go ahead and move your arms and your wrists. She has full range of motion in her arms. And you can shrug your shoulders. Good, so she has full range of motion in her upper extremities. And then I'd want to test her grip strength. So go ahead and squeeze my hands. So she has strong, equal grips. And you can go ahead and pull me toward you. And push me away. So good, she has really strong grips and they're equal. So now we're going to go ahead and look at her abdomen. So go ahead and lie flat for me. And it's just more comfortable to have your patient lying flat whenever you're inspecting the abdomen. So first thing we're going to look at is just inspection. You want to look for symmetry. I don't see any bulges or pulsations of the abdomen. The skin color is consistent. Her umbilicus is midline and there's no inflammation. So then after you've inspected it, then you would want to go ahead and auscultate her bowel sounds. And her bowel sounds are audible and active in all four quadrants, and they are normal active. They weren't hyperactive or anything or hypoactive. So then after you've auscultated, then you'd want to go ahead and palpate the abdomen. You would just start with light palpation and then move on to the deep palpation to palpate for the liver and the spleen. So I'm just going to start with the light palpation and just noting any tenderness in the abdomen. And then you want to go ahead and palpate the liver if you can, looking for those liver borders. And sometimes you have to go really deep up under the ribs. Go ahead and take a deep breath in. And then sometimes you can feel over here for the spleen. But usually the spleen isn't palpable unless they have splenomegaly. So then after that, I'm going to go ahead and look at her lower extremities. I'm looking for symmetry and skin characteristics. if she weren't wearing long pants, you could look and make sure her skin is okay. You would also want to observe for any varicose veins, hair distribution, things like that. Also, you'd want to palpate the pulses. So I'm going to go ahead and palpate the popliteal pulses and the posterior tibial and dorsalis pedal pulses. So just palpating the pulses down here, and you want to make sure that they're strong and equal. And then feeling the pedal pulses as well, make sure they have good circulation in their lower extremities, which she does. And then you'd also want to test range of motion in the lower extremities too. So go ahead and wiggle your toes for me. And bring your feet up towards your head. And push down on my hands. So she can perform the foot pumps equally. Then you can go ahead and have them bend their knee up. And the other side. And this tests range of motion in the knees as well as the hips because they're moving that hip as they move that leg up. So then once we've done that, while she's laying down, I'm going to go ahead and have her perform a neurological test. It's the heel to shin test, just since she's laying down. So I'm going to have you bring this heel down this shin. And you want to make sure they can do it in a straight line, which she can. Okay, now the other side. Heel down the shin. Good. And that, if they had any deviations, if they couldn't bring that heel all the way down the shin, or if they fell off, then that would indicate a cerebellar dysfunction. Also, I'd want to check for a Babinski reflex. And to do this, you can use a pin. Sometimes you can just use your thumb, just a hard knuckle, and you're going to move it up the bottom of their foot, up towards their toes. And a normal response should be, curling of the toes. We want that plantar response, so their toes should curl in. The Babinski response would be if their toes fanned out, and that would be abnormal in an adult. However, it is normal in an infant. We don't want that in an adult. So now that I've done those, I can check her musculoskeletal system, just kind of observing her joints. So go ahead and sit up again. Okay. So go ahead and stand up for me. So as she's standing up, I can observe her gait and her range of motion and assess her joints. So go ahead and do a knee dip for me. Good. And I didn't hear any crepitus of the joints. And then I would have her turn around so I can look at her spine. I want to check for kyphosis, which I don't see. She can stand straight up. Go ahead and bend over for me. And I don't notice any scoliosis or anything like that. Go ahead and stand back up. Another way to check for scoliosis is if their shoulders were uneven, that would indicate a curvature of the spine. So go ahead and sit back down. Okay. So now we would we need to perform the Romberg test. So go ahead and stand back up. The Romberg test just also kind of is a neuro and a musculoskeletal test. You just have the patient close their eyes. Have you stand with your arms at your sides. And just kind of have them stand there with their eyes closed. Just kind of note they shouldn't sway or fall off balance. Another thing you can do while they have their eyes closed is go ahead and lift one leg off the ground. It doesn't matter which one. And the other one. Sometimes it's hard for people to do it, but usually just with them standing there with their eyes closed, with their arms at their side, that should indicate that's a normal response. We don't want them to sway or fall off balance with them just standing there. Okay, go ahead and sit back down. So now some other neurological tests we can perform would be the rapid alternating movements of the fingers. So just do So go ahead and I'm going to have you touch your thumb to all your fingers and back. Okay, and the other hand. So she can touch her thumb to all her fingers and back, which is good. And then another test, which I've actually done a lot in the clinical setting, is the finger to the nose test. And you can also do it finger to finger, but you have the patient touch their nose and then touch your finger. So touch your nose, now touch my finger. Touch your nose, touch your finger, touch your nose. Good. And they should be able to track that and pinpoint it. They should be able to touch their nose and your finger without any difficulty. After those neurological tests, you'd want to test the patient's sensation to sharp or dull objects. You could do this with a Q-tip or a tongue blade, but you'd want to test their sensation on their face and their arms and their legs and their feet with their eyes closed, and you'd have them identify it as a sharp or a dull sensation. After doing the sensation test, you would want to test their deep tendon reflexes using a reflex hammer. I don't have a reflex hammer, but you would definitely want to test their brachioradialis reflexes. So you would test it right here at their elbow. And then you could also do the patellar on their kneecap, having them sit on a table with their legs dangling, and you would use the reflex hammer and test it on their kneecap, and they should have a normal response. And that would be testing their deep tendon reflexes. So after all that, this concludes our physical assessment.